Hey, this is Dr. Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and welcome to Plastic Surgery TNA. This is a podcast that brings you not only transformations, but truth in transformation. As I mentioned before, I am your host. I've been an Atlanta plastic surgeon for about 20 years, and I want to make sure that you have the information that you need to make the best decision in your journey to your best version of you. If you are a returning viewer, thank you. I really appreciate you supporting the channel. It really means a lot to me. If you are a new viewer, welcome, welcome, welcome. Please do me two favors. Please like or subscribe to the channel and share if you think this information would be pertinent or important to somebody that you know, care, and love about. On that note, today's topic is about a dangerous doctor, and her tale is really the tale of, unfortunately, many doctors across this great nation posing as plastic surgeons. And you ask yourself, why do doctors do that? Why would they risk everything to pose as a plastic surgeon? It's straight money. Plastic surgery has the history of having a component of its services that deal with cosmetic or aesthetic surgery, and that is a fee for service or cash and carry. In the world of medicine, as doctors get squeezed by insurance company and government regulations, and it gets to be very, very difficult to, one, practice, especially if you want to practice in your own business, because doctors get paid less to see you for your cold, your blood pressure problems, your diabetes, or for heaven's sakes, if you need surgery in your gallbladder out. They're getting squeezed. A gallbladder surgery may cost you your deductible, your copay, and some other associated fees, but the doctor may get reimbursed $500. $500 to safely take out your gallbladder in a very difficult situation with your life in their hands. It just doesn't make sense. If it doesn't make dollars, and it doesn't make sense. I hate to say that. That's the reality of where we are. And so what do doctors do? I can't keep taking insurance. I'm a general surgeon. I'm getting pounded every night on call. I'm not making it. I can go work for the hospital and they'll just kind of use me up and then try to, take away money from me by, cutting my pay. Hey, I'm going to take a course and I'm going to learn how to do liposuction. Hey, I'm going to take a course. I'm a general surgeon. I work in people inside people's abdomens. I can do a tummy tuck. Yes, they can technically do it, but they don't know how to take care of it. They don't have an aesthetic eye. They've not been trained completely on the vascular anatomy, how to take care of complications. It's more than a notion. People and doctors have dumbed down plastic surgery and make it think it's like going, and I mean no disrespect to this industry, get your nails done. It's not that. It's not that. So doctors who aren't formally trained and certified by the American Board of Plastic Surgery are at a crossroads. And so they turn to plastic surgery and start doing injectables and fillers and breast augmentations and liposuctions and BBLs. And they're not trained. They just take these courses and then just start experimenting on the general public at large, and they end up with problems, and patients, customers slash clients suffer. I'm going to tell you about a bad scenario that I thought, had a, unfortunate outcome, but, was kind of behind us. I'll use that term, us, because I was involved in it as a practitioner trying to help these unfortunate patients. As a patient by the name of a doctor by the name of Dr. Wendell Boutte here in Atlanta many years ago, probably about 2014 to 17. She and I crossed paths, unfortunately, because she was a board certified dermatologist. There's nothing wrong with that. That's fantastic. And I even think she was a really good board certified dermatologist from what I heard. But, again, she's probably going to take medical insurance for the most part. Yes, dermatologists can do fillers. That's not a problem. They can do some small, office type surgeries. Heck, they may even do some minor liposuction. No, no big deal. But she was doing breast augmentations, tummy tucks, breast lifts, BBLs, and was really brash about it. So brash that she was not taking care of clients, patients, and they were getting in all kinds of trouble. And unfortunately, a lot of these patients ended up in the emergency room. And unfortunately, they ended up in the intensive care unit. And then fortunately, I was on staff and they would call me in to take care of these things. And so I'm going to give you an excerpt from a video expose by WSB here in Atlanta, probably about 5 years ago, talking about Dr. Boutte and her practice of plastic surgery, which burns my hide because she's not a plastic surgeon, to kind of give you, I would hate to say the background of what happened, because fast forward, there's more to the story. So let's first roll this expose.
$200,000 after misleading patients about her medical certification. Take a look. You'll remember this video. A Channel 2 Action News investigation led to her license getting suspended. Channel 2's Nicole Carr is live in downtown Atlanta. And Nicole, attorneys say this ruling is just the start.
Right, and that's because you have a couple of different fights here. These multiple civil claims, this push for tougher credentialing laws here in Georgia. But what was announced this week can help people who lost money before they ever went under the knife.
I was happy to see that Dr. Boutte consented to it and finally is taking some responsibility.
A Channel 2 investigation has led to another major development in the case of the dancing doctor, Dr. Wendell Davis Boutte. We introduced you to Boutte in 2018, highlighting a number of settled and pending malpractice claims of botched surgeries against Boutte.
First, let me comment. I work with both. You have two attorneys up here. I work with both of them. They were really great to work with because I became part of the investigation because I cared for a couple of these patients that had these horrendous outcomes. Great to work with. Uh, Secondly, unrelated, I want to give my respect to Javita Moore, who was the lead anchor on this story, who succumbed to brain cancer. Uh, Really admired her work. I hope her family is in the best place they can possibly be. All respect to Javita Moore. Lastly, back on task, this is to my colleagues, and I'm specifically speaking to plastic surgeons. You're 50 years old and you're doing stupid dances like you were 20. There's nothing wrong with 20-year-olds doing dances like that. They're 20. We did them when we were 20. You're 50, you're 45, you're 60, and you're doing all these stupid, really juvenile things. And for what? To get more clients, to get more patients? You're going to dance around like a gesture. You're going to do stupid stuff with dub voiceovers, sounding like you're, sucked on an air balloon because it's funny. You're not a comedian. If you want to be a comedian, then I don't know, do some improvisation. You're a doctor. You're devaluing yourself immensely just to get in front of clients, just so that you can have 10,000 followers, 100,000 followers that basically, you know, may or may not ever become your clients. But you're willing to demean yourself to that level. Stop it. You look stupid. If that's your nature and that's who you are 24/7, then you do you. But I'm going to say the docs I know, that's not their demeanor. They're not naturally funny. This is not who they are. They're just regular folks. But they're doing this because they're freaking desperate and they're trying to get in front of people. On the other note, clients, patients, stop it. Just because a doctor has 100,000 followers and does the latest dance move and it's got these stupid sayings doesn't mean they're good. Just because they don't do those things either doesn't mean they're good. You have to do some research. You have to do more. So, moving forward, I will be having commentary during these exposés. I've got another one, but just to warn you.
This was like a freak show.
It led to the Medical Composite Board suspending her license. While a number of lawsuits are pending, the state has stepped in. It's ordered Boutte to cough up $190,000 to 38 victims, consumers who had paid in full but never had surgeries performed after Boutte's license suspension.
And when you don't return the money to those that had paid, that's just wrong.
Georgia Attorney General Chris Carr.
It is dangerous when medical professionals misrepresent their qualifications, plain and simple.
But the attorneys involved in the cases against Boutte are eager to see people who appear to have been
I'll work with these two ladies.
like the anesthesiologist who danced by her side, held responsible too.
It doesn't go far enough to address the other people in the room who were complicit, who knew about these representations yet still participated. And the board has not taken any action against them.
Our end goal is to see some legislative change in Georgia.
Georgia allows doctors to practice medicine outside of their specialty, regardless of their board certifications. Boutte, a dermatologist, claimed she was certified in cosmetic surgery on her website. The state now says those claims were false or unsubstantiated.
Okay, we're going to work backwards for the last segment that we just saw. There is no board of cosmetic surgery. People, listen to me. That is not an accrediting board. It is not recognized by the AMA. It is not like the American Board of Pediatrics, the American Board of Internal Medicine, the American Board of Surgery, the American Board of Plastic Surgery. There is no such thing as the American Board of Cosmetic Surgery. So red flag number one. Number two, yes, in Georgia, if you are a physician, you have a unrestricted medical license. So if you are trained in ear, nose, and throat, and you decided you want to deliver babies, you have the right to do that. So again, it seems a little unfair, but as the client, you've got to do your due diligence and research to make sure that the doctor that you're considering is actually trained in what they do. So moving forward.
It goes back to they have really loosened up the rules on the truth in advertising for doctors in Georgia. And that's a problem because then the onus becomes on the consumer and to do their homework on their own doctor. And most consumers don't question doctors.
So they see a long fight ahead for victims in the courtroom and here at the Capitol. Now, the AG says if Dr. Boutte doesn't pay up, she could face more than $600,000 in civil penalties alone. We're going to link a link to where you would file for claims to this story on our website, WSBTV.com. Live in downtown Atlanta, Nicole Carr, Channel 2 Action News.
And Nicole, as you know, we've talked to so many of her former patients. It'll be interesting to see what they do now that this has to happen. Thank you.
All right. Just to clean up some of the details on that was aired in 2019, I do believe. One, they did try to go after the anesthesiologist or the anesthesia provider and say that he had some accountability. I think I read or saw in my research, brief research, that he was exonerated of that. He was not held. He could not be held liable for that. I think in an operating room, it's for the surgeon, for the plastic surgeon, you're the captain of the ship. And you have other players, your team members, that should hold you accountable. Yes, you are the captain, but you should be held accountability. You don't escape accountability just because you're the captain. So if other team members feel uncomfortable and they think something's happening that's unsavory, they got to step up. So that's my opinion. To summarize, Dr. Boutte was out there doing her thing. She was misrepresenting herself. Here are some of her Facebook ads that I pulled up. The latest post was from 2015, so it's not an active site, obviously, or she's not posting anymore on it. But she's blatantly posting that she can, do a tummy tuck, and she's a dermatologist. Again, it's nothing wrong with being a dermatologist. She's not trained to do that. Here's another ad. Again, this is just misrepresentation. And you, as the client, you have to be aware of this. Nowhere do you see uh, American Board of Plastic Surgery, a symbol that would represent that, a website that you can click on that shows you that, hey, yes, she actually is, board certified in what she claims she uh, provides as a service. Nothing. Just shows you that, hey, I'm a boss babe and I can do this and this is what I do. But what happens is that in my cases that I had my involvement with her when these patients were in ICU, these patients had flesh eating kind of bacteria. I take them back to the operating room multiple times to try to get rid of that, which led them with more scars. Because at that point, when you've got, serious infections all over the place, the cosmetic surgery is over. There's no more trying to hide incisions. We just got to do what we got to do to stop the problem and save your life. Of the two patients that I took care of, one walked out of the hospital, obviously physically scarred from what happened, emotionally scarred, and it looks like she's in a much better place. And I certainly hope she is. She and her family. The second patient wasn't so fortunate. She ended up with brain damage. I mean, it was pretty much had pretty much already occurred by the time she arrived at the hospital. But, you know, we try to take care of wounds. My counterparts and colleagues in medicine try to take care of her, you know, brain injury. But I mean, the damage was already done. So it's pretty sad. You would think with all that so called death and destruction and just, you know, painful time in life for the patients, their families, and loved ones. And hey, Dr. Boutte, although she didn't do the right things, is still a human being. She had some pain and suffering. And you would think, fast forward, several years, that Dr. Boutte will learn her lesson. Let me just be clear. She has not. So I'm gonna just bring up the next video because this was brought to my attention. So I'm gonna roll video. This is probably a video, an expose within the last 3 to 6 months. So here we go.
It's here now, and Justin, you learned this doctor still has a suspended medical license here in Georgia.
She has no active medical license, Karen, that we can find anywhere. It's those dancing videos on social media that made Dr. Wendell Boutte famous, and turns out it was also social media that inadvertently exposed her new identity to former patients.
Good morning. How are you? Good.
We sent a Channel 2 producer undercover at Eden Med Spa in Austin, Texas.
Okay, and me?
We came because of who is seeing patients here.
How long have you been doing this?
I've been doing injections 1997.
Dr. Catherine Davis, MD, was listed as the owner of Eden Med Spa on the website. It touts Dr. Davis's experience at UCLA, Cedars-Sinai, and Emory. Hi, Dr. Davis, or is it Dr. Boutte? It's Justin Gray from Channel 2.
Oh, look at her run.
Do you have a Texas medical license? Davis started laughing at that very serious question.
Laughing.
But there's nothing funny about the memories that flooded back when O.J. Liber got a Facebook friend suggestion for Catherine Davis.
This is the son of the lady that I tried to care for who came to that particular hospital, who had wounds from a cosmetic procedure. I don't remember, so I don't want to say something erroneous. This is the young man that I had to talk to and tell him that from a plastic surgery standpoint, we're doing all that we can to rectify that. My colleagues had to tell him that his mother, who was a bright young lady, which you'll see in this expose with really a lot of great things ahead of her, probably won't get to live her dream.
Then once I saw it on Facebook, I clicked on it and realized that, that's Dr. Boutte.
The dancing doctor videos from the operating table Dr. Wendell Boutte once posted to social media got viral attention after our 2018 Channel 2 Action News investigation. But OJ was thinking about his mother, Isilma Cornelius. She was about to be married and earn her PhD in nursing when a cosmetic surgery by Dr. Boutte went very wrong, and Cornelius suffered permanent brain damage.
In my 20s, I was now the parent.
OJ became his mother's caretaker every day for 7 years until she passed away last July from complications of those injuries. His was one of a series of more than a dozen malpractice settlements and rulings with Dr. Boutte. Millions of dollars in judgments. The state medical board ultimately suspended Boutte's license. Susan Witt represented many of Boutte's former patients in court.
Patients, for damn sure, have a right to know your doctor's history.
Catherine Davis is Wendell Boutte's middle and maiden names. Nothing about Dr. Boutte's troubling legal and professional history comes up with a Google search of that new identity.
I want somebody who knows what they're doing, working on me.
Exactly.
So we sent in our Channel 2 Action News producer to see what Dr. Davis tells patients. We switched off the undercover camera in the exam room. Davis let our producer record the consultation on her phone.
So as a physician, you're trained, okay, what the worst case scenario?
According to Texas law, it's illegal to advertise or promote yourself as a doctor without a Texas medical license.
She said something really interesting here, and she sounds professional. She looks professional. You can easily be duped. Heck, the lady who had the brain damage was a nurse. She's in medicine. She was even duped. Dr. Boutte says here that you're trained as a physician, of course, to keep in mind the worst case scenario and be prepared for that. Don't disagree with that at all. But she did not practice what she preached. So people, don't be caught up with the slick talk, the nice big office, the fancy cars, the designer shoes, the 100,000 likes on Instagram. That may all be legitimate. But at the end of the day, you got to make sure they are who they are medically. She's a dermatologist. If you need to go in for a rash, you need to go in for a skin cancer evaluation, heck, maybe a skin cancer removal, even some injectables. You want some Botox, some fillers, that's all good. When you start going to her for your breast augmentation, for your tummy tuck, because of all those things, and I'm gonna even say price. I don't know her pricing. It may be on par with what we charge here in Atlanta for plastic surgeons, or it may not be. I'm going to take an educated guess that it's probably a little less, which then entices the potential client or patient more. So be careful, people. Be careful.
There's no license listed for her as Catherine Davis or Wendell Boutte. A consent order in Georgia also bars Miss Boutte from using the titles physician, doctor, or MD, but she has been. Do you know it's illegal to advertise yourself as a doctor in Texas without a medical license? Quiet with us, but online, she is dancing again, this time with needles and advertising.
Ridiculous.
Here you see Davis injecting a patient in an online promotional event. In her consultation with our undercover producer, Davis repeatedly
Sorry, that
referenced
was
her
from my
medical
phone.
experience as a dermatologist and a plastic surgeon.
I've done a lot of abdominoplasties, tummy tucks, breast implants.
I would like her to be truthful to her
Yes.
Do your patients know you have a suspended license? Do you tell anybody on your consultations about Wendell Boutte?
You know you guys are harassing someone?
That's the other owner of Eden Med Spa, Amber Larson. She seemed surprised when we called Miss Davis Dr. Boutte.
Dr. Who?
Dr. Boutte. Her name is Dr. Wendell Boutte.
So I'm a little suspect about her. She's acting surprised. She hired her, or at least co-owns this spa with her. She didn't do any research, even under the false, the other identity of Catherine Davis, and find out that she, did she actually have a medical license? She didn't know that. She was unaware that, even under her alias, she wasn't good. That doesn't even make any sense. So I don't really believe her. She's just BSing us.
No, it's not.
Yes, it actually is. After we sent questions to Eden Med Spa, the language on their website started changing. References to doctor disappearing. We even watched it happening in real time. Then later it was changed again to no longer show Davis as owner.
Yet she's still holding herself out as being a physician who has all of these credentials, but she's omitting a lot of really important information.
This is what Boutte, or as she prefers, Miss Davis, told our undercover producer about how she went from Atlanta plastic surgeon to a Texas med spa.
Pace, and I'm just doing injections, so this is my happy place. This is 58 years old. I'm just kind of like riding it out.
Riding it out, she says. The most recent license for Eden Med Spa on the Texas business registration site was voluntarily terminated in August. We've repeatedly asked the Secretary of State in Texas and Eden Med Spa if there is a new license and who is listed on it as owner, but nobody has answered that question.
Interesting that the license for the med spa in Texas disappears. Again, all suspicious. The co-owner knew that this was way, way sketchy. And she was just trying to, run a med spa because probably she's either not in medicine and she's trying to earn a living. She's trying to, ride the fat pig because cosmetic surgery is cash and carry, or she's a nurse and she needs a a medical co-owner to kind of oversee and protect her. And she probably wasn't willing to pay for a real plastic surgeon. So Dr. Davis or Boutte or whatever she wants to call herself comes in with no medical license. This other owner can pay her pennies on the dollar of her value, and it's all good. So it's just sketchy from all aspects. So my point being here, people, I'm talking to you, the people. You do the research. Now, I know I'm broad brushing. Not everybody does this. You research what type of vacation you're going to take more than you research what type of surgeon is going to operate on you if you want a tummy tuck or a mommy makeover. You research what type of car and accessories more than you research your plastic surgeon who's going to do your breast augmentation. You will spend more money on the luxury package for the cruise, for the drink package, then you will spend having a real plastic surgeon, board certified by the American Board of Plastic Surgery, take care of your BBL. Yes, it's expensive. Everything in life now is expensive. As mama say, and you've heard me say it on other podcasts, you get what you pay for. If you want to pay $6,000 for a BBL, then you're going to get $6,000, whether that's in Miami or Mexico. If you pay more than that, you're going to get better service, more attention to detail. That's my opinion, and that's my reality because that's how I function. You get value for your money. So, how can you protect yourself? That's the bottom line here. We're not here to beat people up, really. But how can you protect yourself as a consumer? First, you just do the research. You just go on the web and you just search and you look at websites and you look for a couple of things. You've got to look for some language that says this: American Board of Plastic Surgery. A little symbol that looks like a little circle says certified by the American Board of Plastic Surgery. If you're unfamiliar with this, if you are considering, you think you are in the midst of it, you're going to go to your first consultation, jot this down. Go to the website, go to the client or customer section. It'll pull up a little database research area, and you can type in the doctor's name that you're interested in having perform your procedure and see if they're certified. Now, they may be legitimate and they may not be certified because It's a timed process. If your surgeon that you're considering is just finished their training, they're 2 years out, they may not be quite at the time mark to take and complete the certification process. That's not a problem. They should say then that they are board eligible, meaning they've met all the criteria to sit for these examinations. If you have a surgeon that you are looking at who's been in practice for greater than 5 years and doesn't have this, to me, that's a red flag. If you have a surgeon that's been in practice that doesn't have this at all after 5 years, like I said, this is a red flag. Either they are a plastic surgeon by training, and you can look at where they trained, and you can look up, you know, go to that training program's website and see if that doctor's name is actually on the website. They usually list their trainees by year, maybe sometimes have pictures. You can do that. So they may be a legitimate plastic surgeon, but they may have failed the exam. It's just as bad. They may not even be a plastic surgeon. That's why this is not on here. So you've got to look for that language. And if it's not there, you got to figure out why. They may be board eligible, and that language should be there, and that's fine. But if it's not anywhere, you got to figure out one. If they say they trained at a certain place in plastic surgery, then go to their website and check out and find their past residence. If you don't see that, you don't see this American Board of Plastic Surgery certified or board eligible, turn the other way. The second thing you can do, you can take that doctor's name and put it in the state board of medicine's website wherever you live, whether that's Arizona, New Mexico, Massachusetts, Montana. I guess I'm on M's today. You know, you just put it in that database and see if your doctor's name comes up. It should if they have a medical license one. And then typically it will tell you what that doctor is certified in, if they're certified at all. It may be that that doctor is a certified in ER or emergency medicine, but yet they're promoting themselves as a liposuction specialist. The two trainings are not the same. And training in liposuction is not a standalone discipline, it is part of plastic and reconstructive surgery training. It's a small tidbit of that training. So red flag, red flag, red flag. The second thing you can probably garner from a state medical website is that whether these doctors have had any type of malpractice issues. Now, there's context to every malpractice issue. Sometimes it's just right out front. The doctor botched it. No ifs, ands, or buts. Sometimes these medical malpractice claims are bogus. You know, they have to be reported, so they have to defend them. So you got to do you've got to do research. Is it bogus or is it botched? Again, if it's botched and they're not board eligible by the American Board of Plastic Surgery, they're not certified by the American Board of Plastic Surgery, then red flags. File on the play, keep it moving. The next thing I would say is, let's say that everything else is good. They are certified by the American Board of Plastic Surgery. They are board eligible by the American Board of Plastic Surgery. They don't have any uh, lawsuits or malpractice suits, or they have frivolous malpractice suits. Go have your consultation. Yes, your consultation is going to cost most of the time for any reputable plastic surgeon. That's my opinion. What is it to spend $100 to make sure that the plastic surgeon is reputable, well trained, has a mind for safety? What's $100 when you're contemplating spending thousands of dollars? It never, it always baffles me that clients would squawk about a fee for consultation. And then on that same note, plastic surgery is expensive. I don't know how they do it in other places, where they can charge you $7,000 for a tummy tuck. I don't know how they do it, but I know what they probably do. They don't spend much time for you. It's a mill. They run you in and run you out. Again, they could be legitimate, but they could have poor outcomes. You're trying to be safe. This is a safety message. The safety is you got to have somebody who's has attention to detail, has good practice, has good judgment, board certified, board eligible. You've got to make sure you do your due diligence in that regard. And any plastic surgeon that has all those green flags, check marks, is probably going to not charge $7,000 for an extended tummy tuck. So you got to kind of pick your lane. That's just my opinion. But back to the subject at hand. This is a dangerous surgeon. This is a dangerous practitioner. She is misrepresenting herself. She is not a plastic surgeon. And the worst thing is she hasn't learned her lesson. It's okay she does injectables. She's a dermatologist, but she's practicing without a license. So she can't be monitored. I hate to use be regulated, but she can't be regulated. It's just selfishness and brashness, in my opinion. She doesn't care. So buyer beware. Some practitioners don't care. If you care and you're interested, you can check me out. I would love to work with you. Hopefully, I'm your cup of tea. I may not be your cup of tea, but you can come sit with me and I'll give you the truth heading toward your transformation so that you have the right information. You can do that by just simply, you can check me out on the American Board of Plastic Surgery. I'm certified. You can call my office, schedule an appointment. There is a consultation fee. It's $225. Let's just get that out there. If you move forward and everything seems to be good and we have a plan and you want to have, a procedure performed by me, that $225 comes off of your surgery quote or proposal. If you don't move forward, then yes, you pay for time and expertise and opinion, just like you would do at an attorney's office, just like you would do when you go get a diagnostic for your car. It's no different. So we do have a fee. If you're ready, call the office. We'll sit down and schedule a consultation. We don't press here. Again, we don't have a $50 consultation, so we have to see 30 consultations. I'm being silly so that we can keep the lights on. We can take our time with you because you deserve the time and your money that you pay. You want value for it. That's where the value, that's one of the places the value lies. We spend time. So you can simply call. If you're not quite ready, you think about it, you want to email for more information, or you got more questions, you want to just direct to me, email the office at concierge@esjaesthetics.com. My staff or I will answer your questions. If you want me to answer it directly, we can set up a quick conversation, 15-minute conversation, discuss your concerns, see if we want to move forward with a more formal consultation. So, on that note, ladies and gentlemen, please beware. Please be aware of all the charlatans out there. You want to be safe. Cosmetic aesthetic surgery is serious. It is surgery, and you want to make sure that you are in the right hands. And on that note, I wish you guys peace, love, and joy. I'm going to Soul Train wherever you are in the world. Thank you for watching. We'll see you next time.